So thank you again, Dr. Suter, for this time. I'm very grateful for your time today. I'm so looking forward to our little chat today. So for those who are not familiar with Dr. Suter, I'm just going to quickly introduce you to Dr. Suter. She's a holistic veterinarian in Chicago area with more than 25 years of experience. Her expertise include acupuncture, chiropractic, nutritional counseling, fecal plant transplant, also allergy elimination therapy, and even animal communication. Mm-hmm. She is the author of this book, What Your Vet Never Told You. So I'll link everywhere. Mm-hmm. On this channel description and also in the social media. So would you like to add anything else?
No, I think that's good. I mean, there's always more to say, but
I know, right? It was just a very brief introduction. So by the way, I just wanted to ask you, what are you allowing your clients to come inside your office with their pets now, or?
Oh yeah, I've never really shut down for everybody.
Oh really? Even during the pandemic?
Well, I'm a one-woman show, so I don't have any assistants, so I had to have somebody there with me. So
wow, that is great. I wish you were here in California with us. So it's been very difficult, at least in my area. Mm-hmm. We're in Silicon Valley, and they're continuing with the curbside service even now. Mm-hmm. So especially for fearful pets, it's been very challenging to see a veterinarian, and we just have to stay in the car, and the staff will come out and they pick up your pet and then go in, and they gotta call you, and we talk to a veterinarian on the phone in the car.
Yeah, it's challenging. I mean, I work at another practice as well where there is more staff. And we did curbside in the beginning as well. But yeah, it was challenging, especially as you mentioned, for the fearful animals, and communication was more difficult.
Yeah.
You couldn't just ask someone right then and there.
Right.
You had to give them a call. So oftentimes we would just do Zoom, or not Zoom, but FaceTime. So we would have the people in the room with us, via FaceTime. That way they could also see what we were doing, and then we could ask questions and such. And sometimes it was also helpful to the animals because they could hear their, people's voice, and so they felt a little bit more comfortable.
But, yeah, that's helpful.
Yeah, but certainly for those animals that were very challenging, we would make exceptions, obviously.
Yeah.
But, I mean, as it turns out, I don't want to go too much into it, but it's like whatever they said.
Yeah, I mean, that's why I wanted to say, like, the online resources like that you have is so helpful. It's always a good idea to have more options, and we always need to be educated, especially now. If in one of the videos you mentioned that everyone is sick nowadays, all the pets are sick, and conventional medicine is no longer working, and I totally agree. So your online resources, Holistic Vet Health and Longevity Method, that's something that we really need right now, I think.
Yeah, and that sort of resulted from this whole pandemic, because it was so challenging, with the curbside and just the stress that was going on, and everything just being so much more difficult, that I sort of burned out a bit, so I decided I needed to do something different. And because we have a veterinary shortage right now, and by 2030, we're in the US, we're going to be lacking 15,000 veterinarians. There's going to be a huge deficiency of veterinarians compared to what we have now. And so it's already difficult now. So you can imagine how it's going to be in like a few years when there's even less veterinarians available, and especially in the holistic field too, because conventional medicine doesn't have much to offer for chronic diseases, which are predominant issue for our pets these days. Obviously, we then have more people who are trying out holistic medicine because whatever their conventional vet is saying is not really helping their animals, or and so they have to switch to something else, and so they're picking holistic medicine. They're starting to put their dip their toes in the water of holistic and natural medicine. And so as a holistic vet, we get overloaded, and we get like new people who want to come in all the time. And unfortunately, at some point there's a limit of what we can take, and
you're only human.
Exactly. And so that's why I decided that we needed to have a solution that is outside of the problem, because you can't fix something from the inside. You have to sort of take a step back and look at it from the outside. And what I realized is that this whole new phase of life, and not just in veterinary medicine, and it's in general, is about empowerment and stepping up to taking charge of our lives, and not waiting for someone to tell us what to do, or waiting for somebody to save us, basically. So we really have to, in a way, grow up, and really take charge of life, and empower ourselves, and trust ourselves more. And so I decided that I wanted to do that for pet parents, pet guardians, however you want to call it. Some people call it that way, and I never know. So I decided to create a program where I would support and teach pet parents, so that when they go back to their vets, they can also be more partners with their vets, instead of their vet just telling them what needs to be done. They can then also bring their own, and bring information, and help their vets. So be, real partners, rather than here's the vet in, God in white, basically, who tells you what to do, which, that doesn't, it doesn't really work. I mean, it doesn't work for pet parents, and it doesn't work for veterinarians either, because to be honest with you, that sort of responsibility of having to be God, so to speak, for people, that doesn't work. I mean, the pressure of that is way too high. So I want to help pet parents be empowered, in their choices, and also be able to be proactive, so that they don't end up with pets who get sick in the first place. And I understand that obviously the veterinary field and the knowledge field of holistic medicine is huge. So obviously I cannot expect anyone to know everything, including veterinarians, obviously, too. But obviously, as a veterinarian, I know a little bit more. So I provide knowledge and support to pet parents, through videos that gives them a really good foundation of what medicine and holistic medicine is, and what it takes to keep an animal healthy. But then I also provide the live Q&As, where they can then ask questions that come up for them, questions on how to implement certain things that they've learned, and also questions about, for example, what does that blood work mean? What's going on here, and where do I go from here? And so I can help support them in their journeys. And at the same time, because they'll be more educated and have that support from me as a veterinarian, it takes a little bit of the load off of my colleagues as well, because then I'm the one answering some of these questions that they just don't have time to. Because as a veterinarian, when you're in the middle of a consultation, you're trying, we are always trying to educate, but you can never educate to the level that you would like to, because there's just not enough time. Otherwise, consultations would be like 5 hours.
I don't think they don't even
longer. Yeah, so that doesn't work. So as a result, because they're better educated and they have some guidance from me, that it then makes it a bit easier for the veterinarians that they're working with as well, because it takes a little bit of the load off. So to me, it's a bit of a win-win-win-win situation, because it helps the animals. It helps the animals. It brings a little bit of peace of mind, and guidance to the pet parents, because pet health and human health is very closely connected and very similar. The basic principles are the same. people also learn about their own bodies and how to help their own health in the process.
Right.
And then it also helps my veterinary colleagues. So
It's wonderful.
it's like a win-win-win-win-win situation.
So
And
many ways, yes.
I'm really happy that I sort of stumbled across it. You know, it wasn't my invention on that level. I mean, it came from, you know, you get inspired basically.
Oh,
but-
wow.
So that's what I created for people, and I'm really
That's wonderful to have
excited.
that.
Yeah.
So
Yeah.
I asked people what they want to ask Dr. Suter prior to today. And I realized that a lot of people are not even sure what the actual difference between holistic and conventional medicine,
Oh, okay.
believe it or not.
Yeah.
I don't blame them because sometimes it's not that clear.
Mhm.
Because sometimes they provide acupuncture, but at the same time they prescribe Remedal, and then they remind you of vaccines and
Mhm.
you know, heartworm disease prevention medication, and it's like
Mhm.
all in one.
Mhm.
So it's sometimes it's hard for pet owners to know what's holistic and what's not.
Mhm.
So if you could explain briefly what is truly holistic means.
Mhm. Yeah, definitely. And before I do that, I did see some of the questions on Instagram, but they were all in Japanese. And I was like, I can't read that. That was so funny. I was gonna take the time to, you know, put it in like a translating thing. So I could
It
see
never
what
works
people want.
though.
It doesn't?
Kind of weird.
Oh, okay.
Yes,
Yeah.
while you do
Anyway,
that,
I can start talking about what the difference is. So obviously we have Western tradition, well, not traditional, it's conventional medicine, because traditional medicine is more like Chinese medicine because there's a really, really long tradition.
Yeah.
Whereas Western medicine has only been present for a couple hundred years or so. I don't remember the exact number, but there are a lot of other medicines that have been present for much, much longer than that. So those are considered the traditional medicines, whereas Western medicine is considered more of a just conventional medicine. So anyway, so we have Western medicine, and then we have naturopathic medicine that involves more natural things. When we put the two of them together, oftentimes it's called integrative medicine, where a veterinarian will practice conventional medicine, but they will also use natural things depending on what the condition is. And holistic medicine and integrative medicine is, in a way, a little bit can be used interchangeably, because holistic medicine means the whole thing, you know. So it means not only including conventional and naturopathic medicines, but also including the whole body and mind and spirit and the family, and basically really just looking at the animal as a whole, and also including the family in that. So it's really looking at everything. And then generally with holistic medicine, obviously we tend to use more natural approaches to things, herbs, nutraceuticals, you know, supplements, acupuncture, chiropractic work, whatever it may be, things that are just a little more natural and tend to be more supportive of the body, rather than just putting a band-aid on it with conventional medicine. And but even as a holistic veterinarian, I will still use conventional medicine, because if I have an animal that is in a lot of pain, I will want to do something for that, because it's about quality of life.
Right.
You know, or if they have a raging skin infection, I
Mhm.
will use antibiotics too, until to just buy me a little bit of time to look at the underlying cause. Because in holistic medicine, we try to look for the root cause of the issue. So we try to not just focus on the symptoms, we focus on what is actually causing the symptom. So kind of like a car, you know, your car engine light comes on. Conventional medicine would just put a band-aid on it or a piece of duct tape, and then you just can't see it, and you continue driving, and eventually the car will die on you. With holistic medicine, what we do is we actually look at, why is that car engine light on? You know, why is there a symptom? And then we try to fix that underlying cause. So that's a little bit of the difference. But, you know, it's not that one system is better than the other. It's just that it's used differently. So for conventional medicine, for example, if a dog has a broken bone and the, you know, part of the bone is sticking out of the leg, obviously it needs surgery, right? Or if it ate a ball and it's stuck in the stomach and it would, you know, die if you don't take it out, then you want conventional medicine. If you want to do diagnostic workup, conventional medicine is really good with that. Because they have all the diagnostic tools, you know, ultrasound, MRI, radiographs, blood lab, you know, labs, etc. So that's what they're really good for. If we were to compare it, they're a little bit like the firemen. So if you have a house that's on fire, you're not going to ask the carpenter to come and fix the house. You're going to get the fireman out first because you're like, let's just put a little water on that. I'm getting a little hot in here. Let's you know, blow out the fire.
Absolutely.
But then after you extinguish the fire, you have to rebuild the house. And that's where, you know, holistic or integrative medicine really come in. Integrative obviously can extinguish the fire and then also build up the house afterwards, you know, or simultaneously in some instances. So it's just two different systems that have different strengths as well. You know, with the more natural approaches, as I said, we look more at the underlying cause. We help to increase and improve function of the body so that the cells function better and then the overall body functions better and they can be healthier. And we also have more tools and abilities to help with chronic diseases, which are so prevalent these days.
Pet owners, we have to know better in order to navigate through what's chronic, what's acute. One of my clients, his veterinarian prescribed Remedal. He was a little bit weaker in the hind end, and that was the only issue in the beginning. And he was totally healthy. The blood works were all great at the time. He was on Remedal for about 3-4 months straight. And it's been very difficult to book an appointment. I think the owner just let it happen without rechecking the blood work or anything. And slowly the dog lost appetite and started having diarrhea, and he eventually stopped eating altogether. So I think that pet owners need to know what are the side effects of certain medication or what's to be used in an emergency situation, what not to be used for long term, or we just need to be educated a little bit more, don't you think?
Oh yeah, definitely.
Especially if it's hard to book an appointment with hospital.
No, that's very important, and there's a little bit of some reviewing of the laws and so on that's also going on, where there should be more requirements of the veterinarians to actually tell people about side effects. But the thing is that, you know, in this fast-paced world where we have one client after another, that becomes really challenging to do, you know, with lack of workforce and so on. But I would just suggest that every pet parent really read about the things that are being prescribed before starting to give them or before even buying them. Obviously, in an emergency situation, if it's like do or die, you know, that's different. But if there's time, you know, make sure that you Google it. I mean, everybody has Google at their fingertips nowadays. It's not that hard to just put it in there and look for side effects and do a little bit of reading on different things before going for it. And that goes in particular for more of the preventative types of things, like some of the heartworm preventatives, tick and flea preventatives, vaccines, etc. You know, because a lot of these are overprescribed, and a lot of these, especially some of the flea and tick preventatives, can have significant side effects and can basically also destroy an animal's life, you know, causing seizures and other neurologic things. So I think that's important that we know what is possible, and I do feel that people should have informed consent, where they have enough information so that they can make an educated decision. And I think it really is the duty of the veterinarians to put out, to provide that. Unfortunately, it's not done nearly enough because, well, there's pharma, there's money, there's the FDA, there's so much that plays a role in it. But I think that as a pet parent, it's just really important that you do some research yourself. Because again, you cannot, as we have seen with this whole pandemic,
Yes.
Let's just say the people who have more say can't really not be trusted all that much, because they too are just humans. And yeah, enough said on that. I think we can all draw our own conclusions on that. What we do know is that all dogs that are vaccinated are developing autoantibodies to certain tissues of the body, and that includes collagen. So there was a study that was done at Purdue University that was very conveniently removed from the internet so that nobody could really see it anymore, but it still was done. Basically, they found that that antibodies were being produced after an animal was vaccinated. Those dogs who never had a vaccine, they were not developing these antibodies. And so one of the types of tissues that gets attacked by these antibodies is collagen. And collagen basically makes up 70% of all protein in the body. Part of the attachment of the tooth to the bone, for example, obviously all the tendons and ligaments, other types of connections, under the skin, for example. So there's a collagen everywhere in the body, basically. And so when that collagen gets attacked, then obviously we will end up with weak tendons and ligaments. And it seems that in particular, the cruciate ligaments tend to be more affected. So that could be a contributing factor to the increase of cruciate ligament tears that we're seeing nowadays. I mean, way back when it was rather rare, and now almost every other dog has cruciate ligament issues.
It was rare.
I'm exaggerating, but it was much more rare. It was definitely not nearly as common as it is now. We also have an epidemic of, removing gonads, testicles and ovaries. And these are important as well for proper growth of an animal, especially if they're being removed right between the closure of growth plates, because every growth plate of the bone will close at a different time.
Right.
So in the bones of the hind leg, if you spay or neuter them right between one of the bones closing and the other one still being open, then the one that's still open will continue to grow much faster still, or much longer than the other one that's already closed, because hormones are supposed to help with closure of these growth plates. And when we remove the hormones, these growth plates will continue to lengthen the bone. And as a result, they then end up with a different alignment of the joint, which that can then cause issues as well, because then the forces on these cruciate ligaments has changed. So that's certainly part of it. And then obviously we also have diet, animals that are overweight, not enough exercise, because all of these joints that an animal has in the body, these joints are stabilized by muscles. And if an animal doesn't have good musculature, then these joints become really unstable. And if a joint is already painful, then it will become even more painful because it's so unstable. And then they will use it less, so they will end up with even less muscle. And then it becomes even more unstable. So it's like this downward spiral that happens. So that's why it's really crucial to exercise the animals and really help maintain muscle mass into old age, because otherwise, they are much more prone to having arthritis. Arthritis is not something that happens overnight. It's something that starts a long time ago.